Which of the following histological findings is most likely to be observed? A 59-year-old man presents with a 3-month history of progressive dysphagia, particularly with solid food, and a 10-pound weight loss. He has had a history of consuming excessive amounts of alcohol and smoking a pack of cigarettes daily for the past 30 years. On examination, the patient exhibits unintentional weight loss and appears malnourished. A endoscopy is performed, revealing a mass in the middle third of the esophagus. Middle third of the esophagus. When we say middle third, does that literally just mean the middle?
Yeah. So like if the esophagus was split into three, it's like the middle of the middle third.
Oh, middle of the three. Okay. Um, okay. So, and if it's malnourished, middle third. I think what happened here is that I don't know if like he had GERD and it like progressed to squamous cell carcinoma because I know that that kind of like progresses up the esophagus. Um, I don't think goblet cells because goblets would like release the mucus, so it's not that. Um, I'm gonna keep the second and third one. I don't think spindle cells or signet ring cells, because I think signet ring cells were found in the stomach, if I remember correctly. So I'm between keratin pearls with it being squamous and pleomorphic cells,
Okay.
but there's no really mention of GERD. So I'm gonna go with C, I think.
Final answer.
Yep.
So it's actually going to
Oh,
be B
more
here. So I'll talk to
squamous.
you. So B is
Okay.
keratin pearls, and that means squamous cell carcinoma of the esophagus, right? That's
Mm-hmm.
mainly dealing with smoking and alcohol. So GERD, right? GERD is going to be something different. That's adenocarcinoma, which is going to be usually Barrett's esophagus with columnar cells and goblet cells, right? Um, Pleomorphic cells, high nucleus to cytoplasm ratio. That's usually like poorly differentiated, right? And then sarcomoid spindle cells, which is sarcoma, usually not in this area. Signet rings, like you said, is usually stomach is where you usually see it. But key thing here is that patient has a lot of risk factors of alcohol and smoking,
Mm-hmm.
so it's likely squamous cell carcinoma of the esophagus.
Right.
The
Because
lower,
adenocarcinoma was, sorry, I didn't mean to cut you off.
no, no, that's okay. Yeah, like adenocarcinoma is usually the lower one third of the esophagus.
Mm-hmm. Exactly.
Yeah.
I just remembered that.
Yep, keratin pearls is going to be kind of your squamous cell carcinoma, which happens with smoking and alcohol. So
Mm-hmm. And adeno is also with like drinking hot food and like
exactly,
hot drinks
exactly.
and whatnot.